Hi, I'm Dr. Devayani Barve. I'm a plastic surgeon practicing in Mumbai. In this video, I'll be talking to you about a common procedure, and a procedure which makes a lot of my patients very, very happy is a mini tummy tuck. Now, how is it different from a regular tummy tuck? A mini tummy tuck is for a select category of patients who have excess skin in the lower tummy, who have a little bit of fat accumulation in the upper part of their abdomen and the sides, and who don't want a major procedure to get their torso looking as best as it can. Now, if you have a large divarication or if the gap in your muscles of the belly is big, then mini tummy tuck may not be a procedure for you. So what exactly does a mini tummy tuck entail? Mini tummy tuck is done to remove the extra skin apron which is in the lower part of the belly. Along with that, we also do a good amount of liposuction of your sides, which is the flanks or your waist, and the upper tummy, so as to not create an unusual contour with flattening only in the lower tummy. Now, I'll just explain that a little more. When we suction the sides and the upper part of the tummy, we flatten that part of your body. I'm assuming that there is no muscle bulge or there is no gap in the muscle, because then that won't lead to flattening of the belly. So this is done for patients who have a good or a fairly good core muscle strength and their abdominal muscles are in place. So suctioning the upper part and the sides of the belly flattens all that. Your belly button stays in its own place. It does not have to be repositioned. The little bit of muscle looseness which may be there in the lower belly for somebody who's had a single pregnancy or who's put on a little weight and then lost it but has never had children, this procedure will be perfect. A little bit of muscle looseness in the lower part of the belly can be tightened during the procedure or may not be. And just the skin excess, which is usually about 4 to 5 inches of extra skin, is removed from the lower belly. This restricts the cut or the incision which we make to a very short length. It is so nicely hidden in the body creases that even in your smallest bikini, it's not going to be seen. At the same time, the combination of power and ultrasound lipo helps us contour the upper part of your body and the sides. So all in all, we are looking at a 3-dimensional contouring of the front and the sides of your abdomen. This gives you a very nicely contoured and shaped torso, may be able to completely flatten your belly, and in some cases, we may even be able to give you a sculpted look. By a sculpted look, I mean we may be able to create that line in the midline and a little cut on the side, which gives you an athletic look if you wish. Now, the recovery for a mini tummy tuck is much easier than that for a regular tummy tuck. The recovery period typically is about a week. The incision will take about 10 days to heal, but there's a waterproof dressing on it, and there's really nothing which you have to do except come and show me maybe once, just to check the dressing and make sure it's healing well. In this procedure, a pressure garment is going to be your very best friend for at least 2 to 3 months. Now, why is that important? Is because the liposuction will leave the skin loose and the fat will be removed, which needs to be addressed. The skin which has loosened after liposuction needs to be given the push to shrink in. A pressure garment does just that. It helps the skin shrink, it helps it redrape to your lovely waist shape and give you the final contour which you are looking for. Wearing it for 2 to 3 months takes care of the initial recovery period and also helps you to keep it in place for the next few months. Now, what exactly does the surgical process entail? It's a 1-day surgery. You come in the morning, you get your surgery done, and in some cases you can even leave the same evening. However, if you want to be a little more comfortable and be given injectable painkillers, then you may stay the night over. Having said that, it's not a very painful procedure. Most patients are absolutely comfortable within 2 to 3 days. They have their garments on, they are on some oral medications, and they are back to their routine. The restrictions after surgery, such as not lifting heavy weights and not working out, also don't apply to mini tummy tucks. You're okay to do your basic activities after a week, and you can even resume some kind of mild to moderate exercise within a week's time. So all in all, mini tummy tuck is an excellent procedure, but for the patient who's the right candidate for it. So the ideal candidate for a mini tummy tuck is somebody who has average to good core strength, whose muscles in the midline are not bulging out so much that they distort the shape of your abdomen. Somebody who has mild to moderate skin excess in the lower part of the abdomen and may or may not have excess fat on the sides. So, this allows us to restrict the amount of skin we have to remove and does not make muscle repair mandatory. Thank you for watching. If you find this video helpful, please share it with somebody who may benefit from it and subscribe to our channel.